So, friends, hello to everyone. My name is Alexei Tatyak. I am a manual therapist and osteopath. I mainly treat diseases of the back and joints. On our channel, we have a wide variety of exercises for almost every situation. That's why in my videos I would like to become a sort of conversational warrior for you and share some interesting facts from medicine and answer the most frequently asked questions that both I and my colleagues encounter during our appointments. And today I would like to dedicate this episode to a kind of well-known parable in manual therapy and vertebroneurology. These are back pains or lumbago. Every viewer of this channel has encountered these, I'm sure. Sometimes all of us experience sudden back pain. What is this, and how is it different from a pinched nerve? It's very common for a patient to come to an appointment and say, "Doctor, I have a pinched nerve." And then he starts describing a shooting pain. There are several important differences. So what is a shooting pain? A shooting pain is a muscle spasm that occurs as the body's reaction to some potentially traumatic action, an awkward movement that the body can't process for a number of reasons. How does that happen? In fact, there isn't just one reason for this. It's always a combination of factors that at a certain moment reach a critical mass. And the trigger itself, meaning the situation in which this shooting pain happens, actually doesn't mean anything by itself. I once had a case in my practice where a patient yawned and her neck got stuck. Does that mean she should never yawn again? Of course not. It just so happened that at that moment, yawning became a potentially traumatic situation for her and her neck flared up, quite severely. Unlike that, a pinched nerve is a chronic process. That is, it's not like everything was fine yesterday, and today, because of some bad luck during a lesson, the nerve suddenly got pinched. The body protects the nerves until the very end, and when we talk about a true pinched nerve, it's always a matter of chronic back pain. That is, for some time the body sends us signals that something is wrong with it. The number of shooting pains per year starts to increase, they become regular, they become recurring, and only then, at the very end, does the nerve enter the compression zone, and the very nature of the pain changes. Now let's talk about pain. During a lumbago, the intensity of the pain doesn't mean anything. That's good news. The pain can range from tolerable to unbearable, when your eyes feel like they're popping out, and that's it, call an ambulance. But such pain doesn't indicate anything specific, it's just your pain volume, which is also multi-component. Pain is a complex psychophysiological process that hasn't been fully studied yet, so it can hurt in many different ways, and it doesn't mean anything specific. Problems may start, and really, when you should start worrying is if, along with the pain, you also experience other sensations, like numbness or tingling. When the pain radiates below the knee, if we're talking about the lower back, or below the shoulder and elbow, if we're talking about the neck, or if you feel a sensation like hot water or something similar in your arms. So, pain plus these additional symptoms, if you notice this kind of plus, that's not a good sign. This means that the pain is starting to take on neuropathic characteristics, and that's when you really need to get further examined. In general, when it comes to examinations, patients often ask me if they need to go get a magnetic resonance imaging. Actually, there aren't that many indications for a magnetic resonance imaging, but if you have the opportunity, as I always tell all my patients, if you can, go and get a magnetic resonance imaging. It's a very visual and safe examination method that will allow your doctor to get the most complete picture of your spine. So if you have the opportunity, go and do it, it won't hurt. But if signs of neuropathic pain appear, that is that extra aspect to the pain I just talked about, don't delay in this case. You need to get a magnetic resonance imaging and figure out what's going on, where something is pinched, and what's actually happening in your spine. What should you do if something like this happens to you? The very first and most difficult thing is not to panic. That means you shouldn't immediately take every medication you can find, call every doctor you know, or try to stretch, massage, or do other sometimes unnatural things to yourself right away. The first thing you need to do is calm down and accept that for today all your free time is already determined by your pain. This is what's called the acute phase of pain, when in a moment of complete well-being it suddenly hits you. It's a very intense acute pain that gets worse with any movement and doesn't let you find any comfortable position at all. In this case, you should rest completely and you can take painkillers on your own for 2 or 3 days. You can do this without worry, and you won't harm yourself in any way by doing so. Painless positioning also helps him a lot. If you have found a position in space where you don't feel pain, try to stay in it as much as possible. So the main task for the first couple of days is rest. The effectiveness of manual therapy, as well as any passive treatment like massages and so on, is extremely low during this period. That doesn't mean you can't do anything at all. I've also encountered this with colleagues that during the acute phase manual therapy is not allowed. Well, I don't completely agree. Manual therapy is possible. You can do manual therapy on regions adjacent to the painful area, let's say. But the effectiveness really isn't very high. In some selected cases, manual therapy can significantly reduce the intensity of pain. But I wouldn't count on that. It's better to stick with the good old rest and protective regimen. The same goes for exercises. Well, let's imagine, yes, for example, if your spine gets a sharp pain, let's imagine a broken arm. It's the same kind of acute injury. No one in their right mind would think of massaging, stretching, or working out a broken arm, right? You need to immediately hold your arm close and keep it still, and you should do the same with your back. The situation is exactly the same. A lumbago is an acute condition, you could say it's an injury, and you need to take care of it at first, especially for the first 3 days. The acute phase requires rest, but baseball and selected exercises such as stabilization and activation exercises, where we just tense the muscles without active movement, can be effective. If it works for you, do it, but for the most part you need to maintain rest. So, after 2 or 3 days, we've endured, we've survived, and the pain starts to subside. Most likely it really will begin to decrease even earlier, usually within a day or a day and a half. Then it starts to get easier, we enter the subacute period, and everything becomes more active. In terms of physical activity, we're already talking about some kind of household physical work. That means you already need to get active somehow, do something, get up, walk, do some simple exercises, and generally increase your level of physical activity. 'Cause it's already necessary. You can also take painkillers as needed, but the thing is, if the pain is tolerable, it's not necessary to take medication. The effectiveness of passive therapy, such as manual therapy or massage, increases. At this point, you can more confidently, so to speak, move the affected area, see how it moves, which part of the range of motion is lost, and analyze the mechanics of the process in more detail, that is, functionally. What went wrong? Why didn't the body cope on its own? The next phase is already the most favorable for passive therapy. That is, when the pain has almost completely gone, we can already perform functional tests. We can already conduct functional demonstrations of pain. And this is exactly the time when visiting a doctor will be most beneficial. Specifically, my specialty is manual therapy. At that point, you can confidently examine the affected area, move it, show where it hurts, and start some passive treatment, such as manipulations. Massage, as I mentioned before, is most effective during this period. Also, again, we increase physical activity. At this stage, you can start strength exercises, you can lift things, and you can work your muscles. So physical activity increases more and more. Which doctor should you see if you have a shooting pain in your back? It's not that simple or obvious here either. It would seem that you should go to a neurologist and have them do the examination and treatment, right? However, if we're talking about a regular neurologist at a clinic with only 10 minutes allotted for an appointment, it's unlikely they'll be able to do a full range of testing. And to understand what exactly happened to you mechanically, why some part of the range of motion couldn't be processed by the brain. However, he will be able to select pain relief therapy for you, which is already not bad. I would recommend looking for a doctor of my specialty, that is a manual therapy doctor, an auto-rehabilitation specialist, possibly a physical therapy doctor, or a sports medicine doctor. That is, doctors who deal with mechanical pain and can perform functional tests and a functional demonstration of the pain. And select for you not only pain relief treatment, but also individual exercises that will speed up the recovery process. In my opinion, friends, the reason for all these back problems is rooted in physical activity, or rather, in its extremely low level. Both in terms of the total amount of movement we do during the day and the variety of those movements. Because, let's be honest, most people these days spend their time sitting. Sitting is not the most mechanically advantageous position for us. Our bodies are actually designed for a variety of physical activities. We should be running, jumping, climbing trees, and lifting heavy things. And the more varied our activity throughout the day, the healthier we will be. There is a very interesting study on this topic which says that during the day we bend forward about 400 times and not once backward. This is not exactly what evolution has prepared our spine for over many hundreds of thousands of years. Also, a low level of physical activity leads to our intervertebral discs, roughly speaking, starting to dry out. Without enough axial stimulation, the tissue of the fibrous ring becomes looser, drier, and the elastic properties of the intervertebral cushion, which is supposed to withstand several hundred kilograms of axial load, are disrupted. By the way, it can't cope because it doesn't get enough stimulation. Here's a quick bit of interesting medical information. The fibrous ring only gets its nutrition during physical activity. Due to the phenomenon of synovial seepage, that is, through compression and stretching of the spine, an accordion-like effect is created and the intervertebral discs absorb nutrients. This process forms the fluid that makes up the nucleus pulposus and overall keeps the intervertebral disc healthy. When our physical, that is mechanical activity decreases, meaning we stop moving, basically the fibrous disc dries out from lack of use. Why waste nutrients and energy on it if I have a great chair that provides external stabilization? Accordingly, the supporting properties of our spine worsen, and it starts to hurt. A decrease in nerve, muscle, and intermuscular coordination leads to the fact that the range of motion we need during the day, even if it's minimal, becomes poorly controlled. That is, but the brain simply can't process the mechanical request. That is basically what I was getting at in the beginning of this video, is that a potentially traumatic situation arises. More precisely, the brain perceives it as potentially traumatic because it can't control it. That's why, friends, the key to a healthy musculoskeletal system lies in physical activity. So don't be afraid to get stronger, don't be afraid to do sports. However, remember that everything should be done wisely. You don't need to, inspired by this video, immediately go and start squatting with a barbell if you've never done it before in your life. The loads should increase gradually, from simple to complex, from light to heavy. But you need to train regularly, you need to train often, and not be afraid, train hard, and everything will be fine for you. Friends, see you in the next videos. I hope I was helpful and interesting for you today. I'm looking forward to your questions in the comments. Maybe we'll cover some interesting things in detail in new videos. Take care, my friends, and stay healthy. To be continued.